Breast Cancer Awareness Month, and as Liz Bonus tells us, a local husband and father wants to remind us that men can get the disease as well. Liz.
Hey Paula, good evening, and good evening to you. For a long time, men treated with breast cancer were told they had one standard for care and treatment. Now this husband and father sharing his story so guys know that is no longer the case.
Started feeling some pain, soreness, and felt a lump.
By the time Scott Chandley found Dr. Hilary Shapiro-Wright, a surgeon at the Fort Hamilton Hospital Breast Center, he'd already been told he needed a complete mastectomy for a diagnosis of breast cancer.
The hardest part for me was telling my sons.
But it turned out he didn't need a mastectomy. A recent study in the Journal of Surgical Oncology is giving men newer options for what's called breast-conserving therapy.
Something we call a lumpectomy, similar to what we do in women, with the addition of radiation, as long as we can get clear margins, meaning no cancer left behind.
So Scott opted for that breast-conserving surgery, along with a much better cosmetic outcome, genetic testing for tissue typing and family risk, and the option of hormone therapy.
We know now that these men do as well as if they had mastectomy, and in some cases even better long term.
Scott is now sharing his story so other men will know that there are newer options, and just like for women, therapy is not one size fits all. He says since guys don't get mammograms,
Until you have it, I don't know that you can find it.
Since he found his own lump, he reminds us.
It's important for men to check themselves the same way as women. I encourage the men that I see in my office that aren't even here for cancer, but for breast pain or something called gynecomastia, which can be breast enlargement, that they do self-breast exams once a month, and if they find something, seek care.
Scott is now in follow-up therapy to his surgery and doing well. He does have a family history of this disease, apparently in an uncle who says he did tell him years ago to be aware and may have helped save his life. Paula?
Thank you, Liz. Only about 1% of men are diagnosed with cancer each year, but often because they don't look for it, it is in a more advanced stage.